in the next minutes I will present a definition of the patient perspective according to a group of doctors. So, eliciting the patient perspective is a core activity of the implementation of patient-centered care. But according to the literature, it is important. It has two main benefits. The two benefits are increasing the patient satisfaction with the consultation and improving the management of the disease, which can lead to better health outcomes. But, there is a but. Despite the emphasis on the importance of the patient perspective, during the medical interview, the information exchange tends to focus on symptoms and clinical history, and often the patient perspective fails to surface. And in addition, when speaking about the patient perspective, a couple of questions arise. So first, what do we mean by patient perspective? And second, how to account for it during the medical consultation. In the next minutes, I will try to answer the first question, and at the end of my presentation, I will tell you how, in my empirical study, in the follow-up study, I will try to operationalize this conceptualization of the patient perspective. So, the patient perspective is a notion that remains vague, and its definition often is implicit in the literature. There are different streams of research which highlights different aspects of the patient perspectives. Some authors speak about the patient perspective as the patient's self-perceived impact of the health condition on his life. Some others focus on the patient's expectations toward the consultation or the doctor, and some other authors concentrate on the patient's preferences for treatment or the patient's priorities among the outcomes of the treatment. So, the aim of my study was to improve the understanding of what aspects of the patient's perspective are important to capture in the context of the medical encounter to facilitate the reaching of an agreement between the doctor and the patient over the definition of the health condition and over a treatment plan. We decided to focus on the chronic pain, on the field of chronic pain. Why chronic pain? So, we decided to focus on chronic pain because chronic pain patients often develop a strong perspective that is based on their experience as patients, living with their health condition every day, and based on their exposure to health information. That means patients who have had different treatments and have met with different doctors over their life. We developed our definition of patient's perspective through 25 semi-structured interviews with doctors active in the field of chronic pain. We asked the doctor to identify the aspect of the patient perspective that, in their opinion, are very important to address during the medical consultation, but that in the routine of the practice are not addressed. We then analyzed the interviews, these 25 interviews, through thematic analysis. And here are the main results. So the doctors highlighted that according to the doctor that we interviewed, there are three main areas that are important to address during the medical consultations. And these three areas are areas that these are three aspects of the patient perspective that prevent the reaching of an agreement over the definition of the health condition and over the identification of a treatment plan. According to the doctor, these three aspects are the most important to address. And they are the patient's beliefs about the health condition and its causes, the patient's expectations, and the patient's point of view on treatment. I'll now present the three aspects of the patient perspective that came out from that qualitative study, and I will illustrate every aspect with a couple of quotations from the interviews. So first of all, the patient's beliefs about the health condition and the causes. A clarification, what do I mean by patient's beliefs? So when I think about patient's beliefs, I mean what the patient thinks he has and why the patient thinks he has such an health condition. For instance, I think I have back pain, because I used to practice artistic gymnastics for 15 years in the past. The causes of a health condition are often the reasons for disagreement between the doctor and the patient. But as we can see in that quotation, it is important, according to the doctors, it is something that is important to address during the medical consultation. If a patient tells you that he has back pain, that his back pain is due to his job as work constructor, you cannot ignore it, even if you know that it's a degenerative problem. In addition, the agreement around the definition of the problem and its causes is a good starting point to start discuss the treatment options, and plus this agreement promotes the patient's engagement in the treatment plan. If the patient understands what he suffers from, there are more chances that he will activate and become more collaborative in treating his problem. If the patient does not understand what his problem is, he won't activate. Let's go now to the second aspect highlighted by the doctors. So, patient's expectations. The doctors told me that usually the patient's expectations are easy imaginable. The patients would like to recover, the patients would like to be relieved by from their suffering. But even though the doctor often can imagine this patient perspective, they think that it's important to address them and to elicit them during the consultation. And that's for two main reasons. First of all, because knowing the patient's expectations at the beginning of the consultation is helpful for the doctor in order to prepare for the interaction in a more effective way. And second, because it allows the doctor to evaluate the patient's expectation and to compare them with the reality. So to sum up, we could say that if the patient's expectations are reasonable and sound from a medical point of view, then the doctor can try to meet them. If the patient's expectations are detached from the reality of what the doctor can offer, then the doctor has a chance to address the existing gap, for instance by explaining to the patient why, in his opinion, recovery is not possible. And here is the third and last aspects of the patient perspective that, according to the doctor, is very important to address. The patient's acceptation of the treatment recommendation is an essential condition for its implementation. So that means that the doctor should not only express his point of view, but he should support it. The doctor should be able to explain to the patient why, in his opinion, a certain treatment is the best option, is a good option for the patient to treat his problem. So it is meaningless to impose a treatment to the patient without explaining why this treatment is, in my opinion, the best course of action. You have to explain, to sell your solution. You need to make sure that the patient himself is convinced and embrace your suggestion. Every treatment proposal is a kind of contract between you and the doctor, between you and the patient, told me a doctor. And in addition, in particular with the chronic pain patients, or with chronic patients, it is a good practice to rule out possible treatments that the patients are not likely to accept. You have to listen to the patient and ask the patient what he already tried, because if you suggest something that he did in the past without any benefit, I think you risk to mess up the relationship with your patient. He will think, are you listening to me? I told you I tried and it didn't work. So, to sum up, this qualitative study conceptualizes what aspects of the patient perspective are important to grasp and to address during the medical consultation. And we can say that they are what the patient thinks they suffer from, what patients expect, and what patients think about the treatment options. These aspects are mainly the result of the patient's exposure to health information and to the patient experience as patient. And we claim that to facilitate the reaching of an agreement between the doctor and the patient over the definition of the health condition and over the treatment plan, doctors could systematically take into consideration these three aspects of the patient perspective. So, for our empirical study, for our follow-up project, We thought about an operationalization of these three aspects of the patient perspective in several questions that the doctor can ask the patients during the medical consultation. And that could be a way of helping the doctor integrate in the routine of the doctor-patient interaction the three aspects of the patient perspective. I hope that next year I will be able to tell you something more about this follow-up study that is an ongoing project, and I hope that I can tell you if it is of value from the doctor's point of view and from the patient's point of view, if the integration of these three aspects of the patient perspective is of value for doctor and patient.